Good morning. My name is Claudia Felicia Limanda with the number 19025111058. Now I will explain about the background of corneal ulcer, why it is so important, and why the further study is needed. So, corneal ulcer is actually a preventable disease that can occur when the cornea is discontinued. It is usually happening because of necrosis. Every year, there are millions of cases regarding blindness because of a corneal ulcer, and that is why it is also established as one of the leading causes of blindness in the world. In developing countries such as in Indonesia, the proportion of the patient with this disease is 10 times more likely than in developed countries. The cause is also very likely in Asian subcontinent such as fungi and bacteria. It can also develop from various and seemingly harmless and unrecognizable everyday activities such as contact lens wear, contaminated ocular medication, impaired defense mechanism, altered corneal surface structure, and so on, which is the reason why the further a study of this disease is needed. So that's it from me. The rest will be explained by my friend. Thank you.
Hello, my name is Untitled Corneal with last 3-digit name 006. So now I'm going to explain about the problem identification of this student project. So the problem identifications are, the first one is what is the definition of corneal ulcer? Secondly, how is the epidemiology regarding corneal ulcer? The third one is what are the risk factors regarding a corneal ulcer? The fourth is what are the symptoms of corneal ulcer? The fifth is what is the pathophysiology of corneal ulcer? The sixth is how to diagnose corneal ulcer, and lastly is what is the treatment and prognosis of corneal ulcer. Next, so the purpose of this student project is to explain about the importance. The first one is the importance to understand this definition of corneal ulcer. Secondly, the importance to understand the epidemiology regarding corneal ulcer. The third one is to understand the risk factors regarding corneal ulcer. The fourth is to understand the symptoms of corneal ulcer. The fifth is to understand the pathophysiology of corneal ulcer. And the sixth is to understand the symptoms and diagnostic criteria of corneal ulcer. And lastly, is about the treatment and prognosis of corneal ulcer. Next. So the significance of this paper student project is it is useful in increasing knowledge and understanding for medical students regarding corneal ulcer, which includes its definition, epidemiology, risk factors, symptoms, pathophysiology, diagnosis, treatment, and prognosis. This knowledge is the basis of medical students, so that later they can fully understand various cases associated with the corneal ulcer itself. Thank you.
Hello, my name is Putri Agnes Monica. Let me explain about the definition of corneal ulcer. So, the definition of corneal ulcer is an ocular emergency due to the defect in the corneal epithelium that involves the underlying stroma. There are 5 etiologies for the corneal ulcer. First is bacteria. The most common bacteria is Staphylococcus aureus. Second is viral. The most common viral is herpes simplex virus. Third is fungal. The most common fungal is Candida albicans. And the fourth is protozoa. So the most common protozoa is Acanthamoeba, and the last is the autoimmune disease.
Good afternoon, my name is Beatrice Agung Saraswati, number 152. Corneal ulcers can occur at any age, but are most common in people who wear contact lenses, especially extended wear lenses. Bacterial corneal ulcers in California are most common in women aged 25 to 34 years. Its incidence occurs in about 60.3 per 100,000 people in a year. Meanwhile, national data on corneal ulcer epidemiology in Indonesia is not yet available. However, incidence of corneal ulcers in developing countries is estimated to be around 100 to 800 per 100,000 people in a year. It is estimated that there are 1.5 million cases of blindness due to corneal ulcers worldwide.
Hello, my name is Bagus Nagasya with last digit student number 022. Risk factor of corneal ulcer. The widespread use of contact lenses increases the morbidity of contact lens-related keratitis. The keratitis generated by foreign body particle is the most common risk factor with 22.3%, with trauma by vegetative material, the second most common risk factor. This was encountered in 12.3% or 16 patients. History of non-vegetative trauma in 10.7% or 14 patients. Anterior chamber inflammation was absenting in 10 patients or 7.6%. Bacterial keratitis caused by a wide range of bacteria with Pseudomonas aeruginosa, the most widespread and pathogenic ocular pathogen, which can cause corneal perforation in the absence of predisposing factor in less than 1 day after onset. Thank you.
Hello, my name is Rosa Badujan Priyatna with student number 115. So for the symptoms, there are conjunctival injections, severe pain, foreign body sensations, variable degree of vision loss, pus or other discharge, sensitivity to light, photophobia, and also swelling of the eyelids and also white spots on the cornea. Patients with bacterial corneal ulcers often present with rapid onset of pain, photophobia, conjunctival injections, and also vision loss. On slit lamp examination, these ulcers appear as clearly defined infiltrates with stromal inflammations and edema. A patient with HSV keratitis will usually present similarly to the patients with bacterial keratitis. Slit lamp examination will classically reveal dendritic lesions with fluorescence uptake. Meanwhile, patients with fungal infections tend to have a more indolent course and often do not have the impressive conjunctival injection seen with bacterial infections. On slit lamp examination, fungal lesions appear as gray-white, feathery, dry-appearing lesions with irregular margins. Ulcers caused by yeast appear as superficial, white raised colonies with clearly defined borders. Thank you.
Hello, my friend. My name is Narswa, student number 135. So I'd like to explain about the pathophysiology of corneal ulcer. So corneal ulcer, we know it as a open sore inflammation in the cornea. So the cause of this inflammation can be like an infection or non-infection. The infection one is like a bacterial infection from Staphylococcus aureus, or fungal infection from Aspergillus, Fusarium, and others. Viral infection from varicella zoster or cytomegalovirus, and then it can also be caused by a protozoan infections like soil and freshwater protozoan. And the non-infectious cause from corneal ulcer can be caused by overwork of autoimmune system, such as systemic lupus erythematosus or SLA, rheumatoid arthritis, connective tissue disorder, and other autoimmune disorder. Thank you.
In order to diagnose a corneal ulcer, a full medical history of a comprehensive clinical examination using a slit lamp micromyoscopy are required. Some diagnostic methods used are fluorescence stain, cultures from under the ulcer, confocal microscopy, histology, PCR identification, and high-definition photography. And the initial indication is the decrease of transparency owing to leukocyte infiltration of the cornea. This forms in the same manner as skin does till the abscess separates and the corneal matter is lost. As a result, a hole with grayish fluor is formed underneath the corneal surface. Diffuse punctuate epithelial lesion, dendritic lesions, or ring-shaped infiltrates may be seen during the examination. Fungal infections are more insidious than bacterial infections, and they seldom result in dramatic conjunctival injection observed in bacterial infections. Fungal lesions show as gray, white, feathery, dry lesions with uneven borders on slit lamp examination. Yeast ulcers show as elevated, superficial white colonies with well-defined boundaries.
I'm Vicky Samantha with the last 3 digit of student number 079. So the best choice of treatments of corneal ulcer are using antibiotic, antifungal, or antiviral eye drops. Antifungal and acanthamoeba therapy are delivered after microbiological evidence, and in some cases, injections near the eye may be administered. In bacterial keratitis, superficial peripheral infiltrates under 2 mm are given. Monotherapy using topical antibiotics, usually levofloxacin 1.5%, but other fluoroquinolones may be given. In cases of large infiltrates or severe infection, topical fortified antibiotics are recommended. When gonococcus is the cause, ceftriaxone is used alongside topical therapy. The use of corticosteroids is optional, but studies found no benefits. In viral keratitis, it is self-limiting, but antiviral therapy increases cure rate. For herpes simplex virus, HSV, topical antiviral, trifluridine in the United States and ganciclovir in Europe are combined with topical steroids, where usually steroids are contraindicated for viral keratitis. It is only given for when HSV is the cause. Varicella-zoster virus, VZV, and cytomegalovirus, CMV, also use ganciclovir as a choice of treatment. Oral antiviral may also be used, but due to its significant side effects, it needs to be closely monitored.
Hello, my name is Siwide Harawati Widyoga with last 3 student number 105. So I would like to continue the treatment for corneal ulcer, especially for fungal and cantomoeba as surgical. For fungal infection, it will be worse outcome if the diagnosis was delayed and limited treatment of choice. Primarily, we can use natamycin with combination of intrastroma voriconazole when the eye does not respond to treatment of topical natamycin. For acanthamoeba infection, in initial stage, we can use polyhexamethylene and in limited trophozoite and case, we can use the combination of previous drug with chlorhexidine. And other option, we can use the combination of neomycin and brolin or monotherapy of chlorhexidine. In severe case, we can also add fluconazole, niamidine, and intraconazole. The last option of treatment is surgery, mainly corneal transplant. This option may be needed to improve vision after healing and a significant scar is left. Lastly, the prognosis of corneal ulcer is different depending on the size, location, etiology, and also how they respond to the treatment.
My name is Christian Bastiantalo, number 075. Okay, for the conclusion, corneal ulcer is preventable disease that can occur when corneal tissue is discontinued because of necrosis. Corneal ulcers have 5 common etiologies. The first one is bacterial, second one is viral, then fungal, protozoan, and autoimmune illness. And the most common one is the corneal ulcer because of infectious. And the corneal ulcer can occur at any age. Some symptoms of corneal ulcer including redness of the eye, or we can call it conjunctival injection, severe pain and soreness of the eye, often have foreign body sensation, etc. Thank you.
My name is Chokodot Sinta Damskawati with 3 digit of student number 231, and I'm going to continue the conclusions. So this condition can be induced by high immune activity such as infections and autoimmune such as rheumatoid arthritis and systemic lupus erythematosus. And the best choice of treatments are using antibiotic, antifungal, antivirus, eye drop based on the causes, and lastly surgery, mainly corneal transplant. And prognosis itself differs depending on the etiology, locations, the size of ulcers, and also how well they respond to the treatments. Thank you.